Are you someone who's hesitant to visit the dentist? Maybe you're afraid that one trip will turn into so many more? Well, rest assured, you're not alone. But today I am sitting down with a local dentist who is all about a one-and-done approach to dental care. We have Dr. Phillip Katz of State-of-the-Art Smiles here to explain more. So good to have you, doctor.
Thank you, Robin. Appreciate it.
All right, so we hear that kind of one and done when it comes to dentistry, and we think, you know, is that really possible? But you have significant training in this, and in fact, teach others how to do this, right?
I do, yeah. I'm an instructor, and our dental practice is in Pickerington, Ohio. I'm an instructor. We focus a lot on dental implants, so I'm an instructor in San Diego at a place called the California Implant Institute that teaches dentists around the world how to do this procedure, along with simple implants, advanced bone grafting procedures, kind of full reconstructions. And in Arizona, there's an institute called Spear Education that doesn't teach dental implants only. It teaches kind of rehabilitations, veneers and crowns and full rehabilitations. And dentists fly in from other countries, other cities to get that education there, and I'm an instructor at both those places. So I take a couple days out of my practice each year, which I enjoy doing. I don't mind doing it, to teach those courses out there.
It's probably pretty cool to see other people who have this, you know, like you have this passion about it, this excitement about this procedure.
I love it. I love it.
And okay, so teeth in one day is kind of what you guys coin it as.
Yes.
What exactly do you mean by that? And you know, is it possible, I think, is the question people ask.
Yes, so patients call us on the phone, they don't technically understand what that means, or is that even possible, because they have heard stories where you have to have your dental implants placed and it could take 2 years before you finally get your teeth on top of it.
Right.
So most offices, or in most places, you would first go to the dentist's office, and then the dentist would then refer you to the surgeon, then the surgeon, and then he would refer you to an imaging center to take imaging, then the lab, and then the anesthesiologist. So you'd go to like 4 or 5 different places. We've streamlined all that. We do all that in our office, and we have a technology where we can have the patient come in the morning with a denture or teeth that need extracted, a full mouth full of teeth that need extracted. They've been told they need a denture, and they can leave late morning, early afternoon with fixed, locked-in teeth, porcelain locked-in teeth, and they can go home and eat whatever they want. Their lives change, their self-confidence changes, and they can eat the foods that they've never been able to eat in 20 years or 30 years before.
It really is life-changing. We've talked about that.
It is.
Your mouth, not only does your smile kind of make up your face, I mean, it does. It can change that. And you're saying they can also eat all these foods that they've been deprived of maybe for years.
Yes.
Okay, you say porcelain's obviously what these are made of. Are they natural looking? And I guess that word kind of, some people think, oh, porcelain's so fragile.
Yes.
Tell us about that.
Yeah, they don't look artificial. These look like real teeth. I mean, it's the state of the art in materials in the dental world. They're stronger than natural teeth, so patients can technically eat whatever they want. I tell them to avoid ice and stuff, just like you would your natural teeth, but you can eat whatever you want. You can eat ribs and fish and chicken and steaks and salads. Some patients tell us they haven't had a salad in 15, 20 years because they can't bite into it with their dentures or broken teeth. But these look like real teeth. Patients in the real world, when they go out and see their friends, their friends will not recognize them. They won't know that they're not their teeth. They will look like their natural born teeth.
And you mentioned, you know, going to an anesthesiologist, and you know, you have all these different steps that you put in one office.
Yes.
How does the kind of that IV, the sedation, does that work into it as far as pain?
Yeah. So we anesthetize, we sedate almost everybody that goes through this. We have an anesthesiologist that comes to our office, and patients will basically be cloudy. They'll be kind of in and out of consciousness, and they won't remember much of it, which is nice.
Sure.
And they prefer that because the procedure could sometimes take a couple hours to do something like this. But we sedate almost everybody, and I have a lot of patients that are completely fearful of the dentist. They won't walk into the dentist even to get their teeth cleaned. So without sedating patients, none of this stuff would get done. So that patients actually appreciate that we're able to do all that, and they don't have to go to multiple places to do all that. So sedation is kind of the key to all this working out real well. So. And
you're always taking new patients. You are located in Pickerington, right? Tell us where you're at.
Yeah, we are in Pickerington, Ohio, about 10 minutes east of Columbus. Our address is 156 West Columbus Street, and that's in Pickerington, Ohio, 43147. Our phone number is 614-837-4506. They can reach us on the web at stateoftheartsmiles.com.
All right, it is that easy to get started. Dr. Katz, thank you.
Thank you very much. I appreciate it.